When is a digital rectal exam not necessary for prostate screening? When it comes to prostate cancer screening, many people wonder about the role of a digital rectal exam, often called a DRE. Interestingly, there are several situations where a DRE may not be necessary. The primary method for screening is the prostate-specific antigen blood test, commonly known as the PSA test. This test measures the level of prostate-specific antigen, a protein produced by the prostate. Research shows that PSA testing is generally more sensitive and objective than a DRE for detecting early signs of prostate cancer. Current guidelines from major health authorities, including the American Urological Association and the U.S. Preventive Services Task Force, suggest that DRE should not be used as a routine screening tool. The reason is simple. There is insufficient evidence that adding a DRE to PSA testing improves the detection of clinically significant prostate cancer or reduces mortality rates. Therefore, for men who do not have symptoms or elevated risk factors, a DRE may be omitted altogether in routine screening. However, there are specific clinical situations where a DRE might still be useful. For example, if a man has an elevated PSA level or exhibits symptoms that suggest prostate issues, a DRE can help assess any abnormalities. It's important to note that screening decisions should be tailored to the individual. For men at average risk without symptoms, PSA testing alone is often sufficient. Moreover, healthcare providers emphasize the importance of shared decision-making. This means that discussions between patients and their doctors should focus on the benefits and limitations of both PSA testing and DRE. Many guidelines support the idea that DRE can be skipped in routine screenings without compromising patient care. In summary, a digital rectal exam is generally not necessary for prostate cancer screening when PSA testing is the primary method and the patient has no symptoms or elevated risk factors. While DRE can still be a valuable tool in certain contexts, it is no longer routinely recommended for screening due to a lack of evidence supporting its added benefit. Men should always consult with their healthcare providers to discuss personalized screening strategies that best suit their individual health needs.